This video is talking about being a hair coach or a hair personal trainer. I know that sounds very weird, but basically what I try to do with my patients during every consultation is counsel them to be better at compliance with their medical therapy. The two medical therapies that are usually the standard of care are finasteride and minoxidil. For women, obviously, it's usually just minoxidil. It can be finasteride if they're in the peri and postmenopausal period of time. As everyone knows, finasteride has a risk of teratogenicity, fancy medical word to describe a birth defect, so in a male fetus specifically. So let's talk about how to understand how to be better compliant with medical therapy. So the several things that I always say with the personal trainer, if I told you, look, I really love for you to work out 7 days a week, and maybe on 3 times of that 7 days a week, I want you to do 2 a day. You're going to say, you're crazy. I have no time for that. You know, I can work out 3 days a week. And then if I said, well, you can't, how about 3 days a week? Can we work out 4 days a week or 5 days a week? You say, okay, I can do 4 days a week. So what I'm trying to say is medical therapy is very similar to that. Is as many times as you can do it, it's going to be very, very important. If you don't do it every single day, some therapy is better than none. Of course, I would love for you to do medical therapy every day, finasteride, minoxidil, but if you can't do it, even several times a week can be very, very effective. How many times a week would be the minimum? Unfortunately, there are really no studies to say, okay, you can get away with 3 times a week, you can get away with 5. But if you miss a couple days, it's sort of like I always say, if you had some fried chicken and you thought, hey, you know, I'm just going to give up and never eat healthy again. Well, obviously you understand how ludicrous that is. It's the same way to understand if you forgot your medications, you left them in Mexico, you didn't leave in Mexico, but you forgot them when you went to Mexico, came back on Monday, just start your medical therapy again. So it's not an all or none proposition. The problem, though, is if you did stop for many, many weeks or many, many months, you will lose everything you gained over the time you're on it. So if you were on finasteride minoxidil for a 5-year period and you stopped it for a few months, all that you held will be lost in that precious time. So you really, really need to maintain it for more or less. Now, as you probably know, the conventional way, the traditional route of delivery is that you're using an oral finasteride and a topical minoxidil. The problem with that is that when you divide these two medications into 2 different routes, there's more work. So a few strategies that I have is I try to combine these therapies for optimal efficacy, which to me also really means compliance. If you haven't heard my video about hair genome tests, I really encourage you to watch it as a precursor to this video, or at least after you finish this video, because the hair genome test talks about how I can dose you appropriately with the right dosing based on your genetic sensitivity and resistance for both oral and topical routes. Now, what I try to do is for someone that is doing both finasteride and minoxidil, which I really believe in, to have both of them together because they're synergistic, like playing a piano with both hands instead of playing piano with one hand. Together they work better. They play beautiful music together. Having both of them together, they create a synergistic response. So the way that I look at it is I can actually now give a topical finasteride and a topical minoxidil. There've been a lot of studies on how effective topical minoxidil is, even in someone not doing topical finasteride is, even in someone not doing minoxidil. So a combined topical finasteride and minoxidil is one therapy, one route. I've been, in the last few years, really, really loving oral routes because now what's in vogue is an oral minoxidil. So you can do a finasteride minoxidil combination. Of course, there's a lot of stuff on the internet, on Google, that tells you, look, finasteride can cause sexual side effects, persistent sexual side effects. A lot of men are very scared of it. I will say that the odds are incredibly low to have side effects, about less than 1% statistically. I love the oral route because the oral route allows you to do something very easy, and the compliance is greater. So I love to combine these two oral routes rather than giving the topical route, because I've noticed a lot of men that are doing topical, after a few years they stop doing it and then it becomes a problem. So I like the oral route because of very low side effect profile as well as higher compliance. And so that is what my preferred route is, especially if someone's got very, very extensive loss, maybe even diffuse and pattern alopecia, meaning loss even into the zones down into the donor hair area, which would be a precluding factor for surgery. But it's very hard to apply topical that wide and get good effective results on it. That being said, I also tell patients that if they're really pretty compliant with the oral, but they just absolutely don't want oral finasteride, another combination that I do is an oral minoxidil with a topical combination finasteride minoxidil. Now, why would I split that? The reason is that even though I just told you I like to combine therapies, I know that the oral is so easy to take, and I know that the topical is a little bit more work. So if someone's doing an oral every day, let's say 6 to 7 days a week, and they're doing a topical only 3 to 4 days a week, well, now I've got better compliance because I've got something very easy compliance and something that takes a little bit more work. They may not be doing it every day, but there's some benefit, but they don't want to take oral finasteride, for example. That is my backup route in order to deliver this therapy in a way that provides highest compliance. As you know out there, if I have you take something 3 times a day, you won't do it. They've shown studies where doctors have given something 3 times a day, patients wind up doing it once. Well, here's the good news. Whether you go topical or oral, they're both once a day. And you say, well, wait a second. I heard, minoxidil is supposed to be twice a day. Well, honestly, that's where the FDA studies were done. Once a day is sufficient. You do not need to do it twice a day, despite what the package insert says. So once a day is fine. So these are all once a day, but even once a day topical can be more difficult. And so these are some strategies. The other strategy I tell my patients is, for example, I'm a morning person. I get up at 5 in the morning, I'm working out, I'm painting before my first surgery. At night, I'm very tired. By 9 o'clock, I'm half dead, and 10 o'clock, I can't even think. So I'm not a night person. My wife is a night person. She stays up till 2 a.m., checking emails and doing whatever, and then goes to sleep very, very late. I used to be that, and when I was much younger, in my 20s and in college, I would sleep until 11 or noon. Well, so if you're sort of a night person and you like to stay up way late, in the morning, if I tell you to do something, one, you won't even be awake. You may wake up at 1:30 in the afternoon, or you may just forget to do it because you're in a brain fog. The same brain fog I have at around 9:30 or 10 p.m. where I'm already asleep at that point. So for me, if I need to be compliant, I'm going to do it in the morning. And that's really, really important. So if you are a morning person, do your medical therapy in the morning. If you're a night person, do it at night. Set yourself up for success. The other thing you may have heard about is to build a habit. It doesn't happen overnight, right? So what I do is, for example, I like to make healthy salads from my garden, but I always forget. So I have a reminder that's set on my Siri. Every single day comes up at 6 p.m., get lettuce from the garden, okay? I have that every single day. I have a reminder. I have this pill that helps her with brain function. Of course, if I had better brain function, I would remember to take the pill. But the point of this is sort of an anti-Alzheimer's and sort of help me to remember things. So I have a reminder at night to take this. It also helps with sleep and things like that. So I have a reminder every 9 p.m. that comes up, says take this pill. I may forget to do that otherwise. So reminders are really, really helpful. So one thing you can easily do is if you have an iPhone, you can use Siri or whatever the equivalent is with the Android. But the nice thing with this is that it helps you remember. Now, if you said, after 2 or 3 weeks, you go, I don't need this anymore, then delete the reminder. And so the reminders are helpful. If you're an old school person, you don't use smartphone reminders. I jokingly say I'm my wife's Siri because she never does anything with her phone. She always asks me, hey, Sam, tell me to do this tomorrow. Like, why can't you ask your phone? Well, no, because you're here. Great. Well, if you've got a live human Siri, then have that person remind you. But I don't think they're going to remind you every day. So what you can do is the old school way. Put a Post-it note on your mirror. Leave that Post-it up there until it becomes a habit. You remember to take your finasteride minoxidil. Obviously, if it becomes a habit, then you don't need this anymore. But these are just tips for success. And unfortunately, a lot of times you go see a doctor, all they say is, they grumble, take some finasteride minoxidil, okay, you can take it, or I'm here to help you. That's why I jokingly call myself a hair coach or a hair personal trainer, because what does a coach and a personal trainer do? They help you set up for success. And if you're not taking it, you're not going to get results. Compliance is everything. So hopefully this video of my helping inspire you to do better and be more compliant, it's not all or none, will help you have new pathways and new strategies of success.